What ethical issues arise in global health research? Imagine working in a place where resources are scarce and the community's needs are urgent. Now picture conducting health research there. It sounds like a way to help, but it also raises many questions. When researchers work across borders, especially in developing countries, they face complex ethical challenges. These issues are rooted in core principles like respect for persons, beneficence, justice, and respect for communities. One big concern is informed consent. Participants need to understand what the research involves, including risks and benefits. But in some places, language barriers or low literacy can make this difficult. Researchers must find ways to communicate clearly and ensure people truly agree without feeling pressured. Respecting autonomy means making sure participation is voluntary and informed. Community engagement is also vital. Researchers should involve local leaders and residents in planning and decision-making. This helps ensure the research aligns with local values and health priorities. It also builds trust and avoids exploitation. When communities are part of the process, they feel respected and are more likely to support the project. Assessing risks and benefits carefully is another key issue. In resource-limited settings, risks might include harm or exploitation. Benefits could be access to new treatments or improved local health services. Researchers must balance these factors, aiming to do no harm and maximize positive outcomes. Selecting participants fairly is essential. Justice requires that no group bears the brunt of research unfairly or is left out of potential benefits. Vulnerable groups like the poor or marginalized need extra protection from being targeted just because they are easy to access or have fewer options. The standard of care during research also raises questions. Should participants receive the same level of treatment as in wealthier countries? And after the study ends, will they have access to the new treatments or interventions? Ensuring ongoing access prevents exploitation and promotes fairness. Benefit sharing is another important principle. Communities should gain from the research, whether through new health services, capacity building, or access to medicines. This recognizes their contribution and helps promote health equity. Cultural sensitivity must be respected. Researchers need to understand and adapt to local customs and beliefs without compromising ethical standards. This might mean changing communication styles or respecting traditional practices while maintaining safety and integrity. Building local capacity is also part of ethical research. Supporting local health systems and training local researchers helps sustain improvements long after the study ends. It aligns with the ideas of justice and beneficence by empowering communities. Transparency and accountability are vital. Researchers should openly share their goals, funding sources, and potential conflicts of interest. Clear communication helps build trust and ensures ethical conduct. Finally, addressing power imbalances is crucial. Often, foreign researchers hold more influence than local populations. Ethical research involves recognizing these disparities and working to prevent exploitation or coercion. In practice, this means thorough ethical reviews by local and international committees, ongoing ethics training for researchers, and guidelines tailored to specific contexts. Challenges like political instability or urgent health crises requiring flexibility, but core principles must always guide the work. Overall, ethical issues in global health research focus on respecting human rights, ensuring fairness, protecting vulnerable groups, and promoting health equity. These principles help make sure research benefits everyone involved and contributes to better health worldwide.